Now, and the Mediclinic group has suspended all non-emergency surgeries in the Western Cape. It's in an effort to assist with those admitted for COVID-19. The province has seen an increase in patients and healthcare workers under pressure to deal with the influx. Dr. Gerrit de Villiers is the Group General Manager for Mediclinic International. He joins us now to talk more about this by Zoom, I believe. A very good evening to you, Doctor. Thank you so much for your time. So, you have cancelled these elective surgeries for the moment. How long was the list?
Good evening, Thembekile. Well, the good news is that usually after about the 16th, we generally wind down on the elective and semi-urgent surgery as the doctors start going on leave and the public starts going on leave. So it didn't have a major impact. Those patients that do have urgent surgery that cannot wait that we postpone will still carry on. So we carry on with emergency surgery and urgent surgery. The rest, unfortunately, will have to postpone until the surge in the Western Cape has subsided.
And for those who are coming in for other still serious procedures, Doctor, what difference has COVID-19 forced you to make in how you go about that business?
Yes, so the main difference is that we are testing all our patients upon admission to cohort those patients that have COVID together with other COVID patients and to keep our patients who are not COVID infected together with patients who are not infected. This is to mitigate the risk of anyone acquiring the infection in our hospital. And then, of course, there's a lot of personal protective equipment around, masks and hand cleaning and environmental cleaning. So definitely we've put in a lot of things in place to mitigate the risks of anyone getting COVID while they come in.
You've reportedly seen more admissions now in the second wave than the initial stages of the lockdown. What do the numbers look like?
Well, so as I said in our media release yesterday, we have currently increased from just around 100 cases about a month ago to more than 500 currently. In the last 24 hours, we've admitted at least 40 more patients with COVID. I say at least because we're still awaiting some results on some patients. So there's definitely been a steady increase in the last few weeks, much sharper increase than with the first wave.
Have you been able to make any observations then, Doctor, as far as this new COVID-19 variant that we learned about on Friday and how possibly, perhaps, it behaves in patients?
No, I think the main observation we had that it is definitely a steeper increase in the numbers. And, our anecdotal observation would be that it looks like it's younger patients, and a lot of them are very, very sick. But we haven't analyzed all the data yet. It hasn't been long enough to do that. And we are working with the authorities, for example, the NICD, to do this analysis and to understand this new variant better.
You are training now more staff to go into the high care and ICU units to try and ease the pressure there. Do you think you've got enough as far as your staff complement to see you through the worst of the second wave, especially in the Western Cape, where we're seeing this rapid climb in infections and now admissions?
Yes, we think we currently have enough staff. We are recruiting from other provinces to come and help us temporarily. I think our main challenge, as with all hospital groups and the public sector, is that staff members can be recruited and ready to work, and then all of a sudden either have high-risk exposure at home or at work, or get COVID infection themselves, and then all of a sudden they're no longer able to work. But we have contingency plans. We're moving staff around, and as I said, we're moving staff from other provinces to come and assist us.
Something else that I see you've stressed in your statement is that it's important to note that of the patients that you are seeing who are admitted, the majority of them aren't in the worst condition.
That is quite correct. So the majority of patients we see actually need oxygen, supportive care. Some of them are dehydrated, need IV fluids. So even though our ICU and high care resources are under stress, the majority of patients we can easily absorb, and we have ample beds available still for those patients. You are quite correct. Thank you for bringing that out again.
Thank you so much for speaking to us tonight. Dr. Gerrit de Villiers with the Mediclinic International Group. Thank you so much for speaking to us about the cancellation of non-urgent or non-emergency surgeries, elective surgeries in that part of the country as private healthcare and the public sector try to do their best to accommodate patients currently down with COVID-19. So then,